massive change in the healthcare system in this country. And as such, you had to pick the battle in which you want to say that you want to make sure that every American citizen has access to healthcare. If you stretched it beyond people who are American citizens, then you start to run into a bigger section of the American public who's we've all heard raises the issue about people immigrating here sometimes illegally. Mm-hmm. As an immigrant myself, I'm empathetic to people moving into this country, but there's always this thing of people come here sometimes illegally because they're looking for the pot of gold at the end of the rainbow, which, as we all know, if you deal with people often, as I did with public health, that pot of gold isn't really there. Mm-hmm, so I would say right now that people can check into it, but they should probably go on the assumption that they're probably going to still have to get private insurance, that this healthcare expansion may not be available for them as a non-U.S. citizen.
Mm-hmm. At this time.
At this time.
Yes,
but
well,
again,
it is a huge...
it's interesting because one is a political model and another is a business model. And yes. the business model would say the more people you can get into this, the better you could spread your risk. But again, the politics is, I would only guess that the vast majority of the American public would say this is an American healthcare system and you need to guide it towards American citizens at this point. Mm-hmm. And that's just part of the reality of the political world we live in.
Sure. It's part of the shift, and it's a really big one right now.
Well, I think there's still resources there. For the people, part of the problem in California is the governor administration has taken back what's a lot of money from the counties. In California, the counties run local state programs, and the governor's office and the state have taken back literally millions of dollars. I want to say something along $300 million from the counties because they're making the assertion that nobody will be left that should be uninsured. That money was for people uninsured. The reality at the county level is that you're still providing care to whomever walks into your clinic. Mm-hmm. And these clinics are called federally qualified health centers, or FQHCs. And part of their responsibility is to see whomever will show up at their door, legal, illegal. And the reality is, as public health, is you want to reduce everybody's diseases and communicable diseases and healthcare, because Glenn, as an emergency physician, still has people, regardless of immigration status, show up into his emergency department at 3 o'clock in the morning because they've got a health problem because they have no access to health care. So you sort of have to separate the two in its own right, of an immigration policy versus a healthcare policy. And they're certainly related, but they're on different tracks. And as a healthcare policy, you really want to make sure that you're getting